Today I'll be speaking to you about the Advanced Registered Nurse Practitioner by Brittany Cook, Christy Tucker, Amy Husky, and Kathryn Harvey. ARNP is an umbrella term for RNs who have met advanced education and clinical practice skills. Clinical nurse specialists, certified nurse midwives, certified registered nurse anesthetists, and nurse practitioners all fall under the ARNP role. As a group, we felt like this was a topic we wanted to gain more information about, specifically the nurse practitioner role. The need for primary care nurse practitioner is projected to increase by 30% from 55,400 in 2010 to 72,100 in 2020. Aging and population growth are predicted to account for 81% of this change. Some requirements or qualifications. Education. The typical full-time student can obtain a master's degree in 5 to 7 years, if you include the time it takes to obtain a bachelor's degree. Secondly, experience. Prior to completion of nurse practitioner program, participants are required to complete a minimum of 500 supervised direct patient care clinical hours. The clinical experience is focused on meeting the nurse practitioner competencies. Thirdly, licensure. Submit proof of valid registered nurse license in the state of Florida and malpractice insurance coverage or exemption. Complete master's degree or post-master's degree certification and conduct a criminal background history screening. Finally is certification. The consensus model for the ARNP regulation, licensure, accreditation, certification, and education, LACE, is aimed at providing up-to-date certification information. The new credential process was implemented in 2015 and has since helped enhance patient care and benefit advanced nursing practice. The Florida Board of Nursing states that prior to obtaining an ARNP license, applicants must submit a notarized copy of their national certification to the Florida Board of Nursing. Job responsibilities. Nurse practitioners focus on health promotion and disease prevention. They can order, perform, and interpret diagnostic and laboratory tests, prescribe medication and other therapies, as well as teach and counsel patients. Standards of care. Nurse practitioner education programs, accreditation requirements, and competency-based standards ensure that nurse practitioners are to provide safe, high-quality patient care. Professional organization and website. This is our reference. Impact of the role. The demand of primary care is projected to rise over the next 5 years, due largely to population growth and aging, and to a smaller extent to expanded healthcare insurance. It takes much less time to produce a new nurse practitioner than to produce a new physician. An average of 6 years of education training compared to 11 or 12 years for a physician, including education and residency. This could potentially reduce the expected shortage of primary care providers in 2020 by about 2/3 if they effectively integrated into the healthcare delivery system. In an ambulatory care situation in which patients were randomly assigned to either a nurse practitioner or to a physician, and where nurse practitioners had the same authority, responsibilities, productivity, and administrative requirements, and patient population as primary care physicians, patients' outcomes were comparable.
Healthcare reform and the nurse practitioner. In March 2010, when the Affordable Care Act was passed, 32 million additional Americans were provided with insurance coverage. More healthcare professionals are needed in response. ARNPs are expected to provide the majority of care to the increasing number of patients gaining access to the federal Affordable Care Act each year. According to the American Association of Nurse Practitioners, by providing high-quality care and counseling, nurse practitioners can lower the cost of health care for patients. For example, patients that see a nurse practitioner as their primary care provider often experience shorter emergency room visits, shorter hospital stays, and lower medication costs. Nurses, nurse practitioners, and physicians all strive to implement evidence-based practice. Healthcare is one of the most regulated sectors of commerce, and much of the regulation of the industry comes from federal and state laws. Other regulatory requirements are imposed by various government by various government-sponsored programs such as Medicare, or are self-imposed to conform to various other government and private initiatives. Due to the potential for civil and criminal liabilities and sanctions in regard to healthcare, nurses should be familiar with key statutes and regulations regarding the delivery of patient care. Quality of care. The nurse practitioner role was created in 1965. Over 45 years of research consistently supports the excellent outcomes and high quality of care provided by nurse practitioners. In conclusion, who is the nurse practitioner? The nurse practitioner are registered nurses who serve as primary and specialty healthcare providers under the supervision of a physician. What does the nurse practitioner do? Nurse practitioners work with patients throughout their lives, diagnosing illnesses, conducting exams, and prescribing medication. And why should you become a nurse practitioner? Increased needs in the healthcare field to help create job security for nurse practitioners.